Namaste. A very good afternoon to all. I am Dr. Vinayak Surve. It is my pleasure to welcome you all to the digital launch of globally acknowledged anesthetic brand in India. I welcome all my senior veterinarians, professors, office bearers and members of all veterinary associations, my classmates, my batchmates and fellow veterinarians. I also welcome my colleagues, senior managers and directors who joined this session from Mumbai and various states of India. Webinars are becoming new normal with the lockdown and COVID-19 scenario. This is a period when only one pet parent is allowed to visit the clinic along with the pet. The pet parents wait outside the clinic during long surgical procedures. Thank you. Thank you for taking time out to attend this session while you are doing a great job in fighting against COVID-19 challenges. Zoletil, being a veterinary exclusive anesthetic, offers you flexibility, peace of mind, convenience, and confidence. Our eminent speakers are going to educate us on Zoletil advantage. It is my privilege to introduce them to you. Our first speaker is my colleague, Dr. Cristel Navarro. Dr. Navarro is a veterinarian, graduated from Alfred Veterinary School, France. After an internship in equine medicine and surgery, she spent 4 years in companion animals general practices and joined Virbac in 2008. She is now the Director of Global Medical and Marketing for Companion Animals, Veterinary Exclusive Products. She is certified in veterinary dermatology and pain management. Dr. Navarro is a co-author for more than 100 scientific communications in international congresses and peer review journals. Welcome, Dr. Navarro. Ladies and gentlemen, please join me in welcoming our guest speaker, Dr. Luca Zilberstein. Dr. Luca graduated from Veterinary School of Naples, Italy. He also graduated from European College of Veterinary Anesthesia and Analgesia. Dr. Luca is a former head of anesthesia and intensive care unit at the Alfred Veterinary School. He is a teaching researcher in anesthesia and resuscitation at Alfred Veterinary School. Dr. Luca is working as a specialist veterinarian at Advesia Veterinary Hospital Center in Paris. Being a practicing veterinarian, it was not easy for Dr. Luca to take time out to deliver this speech. I have witnessed how he was preparing for the session with Indian contest while managing his patients. His passion and dedication towards the profession brought him here to share his knowledge with us. Dr. Luca and Dr. Navarro, namaste and warm welcome to you. This session is going to continue for next 1.5 hours. Dr. Navarro is going to start with Virbac introduction for 5 minutes. Dr. Luca is going to educate us on anesthesia principles, molecules, and Zoletil for 45 minutes. Dr. Navarro is going to conclude the session for 15 minutes. Please keep asking your questions through chat box. Virbac team is going to collect all the questions from chat box. We will ask them to the experts on your behalf. At the end, my colleague Vanessa is going to brief you about Zoletil availability map in India for 5 minutes. Dr. Navarro, you may please put your slides on presentation mode now. Let's welcome Dr. Navarro to start with Virbac introduction.
Thank you, Vinayak. So, good afternoon, everybody. Namaste. I hope that you are all feeling good. It's a great pleasure for me and for Virbac to introduce Zoletil in India. Zoletil is one of our best-in-class products and is in the top 10 products of our company at worldwide level. But first, let me give you a few words about Virbac. Virbac is a global company with a worldwide presence in more than 100 of countries and with offices in 33 countries. So we have been on the market for more than 50 years, and we are still an independent vet company, so created by a vet, and we still more than 60% of the voting right held by the founders' family. This means that we have a good sustainability and a good vision on this evolving market. Our portfolio of products covers 50 animal species, so from fishes to pets, and also cows. And it covers almost all therapeutic segments, so vaccines, pet food, diagnostic, or anesthetics. Bringing innovative products to the market is in our DNA for more than 50 years. And in fact, in Virbac, we are really dedicated to provide scientific product, but also easy to use product for the everyday life of the general practitioners. So in our portfolio of anesthetics, we have a molecule such as alpha-2 agonist, induction molecules with ketamine and propofol. We have also volatile anesthesia with isoflurane, painkillers with buprenorphine and soon tramadol. And of course, we have a Zoletil or fixed combination of tiletamine and zolazepam. But before giving the floor to Dr. Zilberstein, I would like to give you a few words about anesthesia. Anesthesia is a kind of intoxication status, but we want it to be dosed, controlled, and reversible. And how we could define the ideal anesthesia. An ideal anesthesia should have clinical qualities. So for example, loss of consciousness, the hypnosis, so from tranquilization to narcose, loss of musculature tone with the myorelaxation, loss of pain sensation with analgesia, and of course it has to be safe. So less toxicity as possible, and it has to be reversible. But we need also practical quality. So the anesthetic should be viable on the economical point of view. It should be rapid, easy to use, and bring comfort for the surgeon. As you may imagine, we cannot find one single molecule that will do everything. So we need a combination of various drugs. On the anesthetic markets, we have a lot of different family of molecules. And if you look at what we expect in terms of qualities and all the families, we don't have one product that can do everything. Yeah. Looking at the Indian market, we can see that you have already quite a lot of different molecules. And on the veterinary field, you have mainly alpha-2 xylazine and also trifluopyrazine. So now it's time to go for the next generation of anesthetics with the combination of tiletamine and zolazepam. But before giving the floor to Dr. Zilberstein, I would like to say that it's the first time for us that we are in such a different period, and that we have to prepare an anesthetic training as a digital way. So I would like just to tell you that we have prepared this presentation in this very specific situation, and talking about anesthesia is not an easy exercise, because it varies a lot depending on the countries, on the culture, and on the habits of the vet. But talking about anesthesia through a digital way is even a harder exercise. So don't hesitate, please, to ask all your questions on the chat. It can help both Dr. Zilberstein and myself to orientate our speech the best as we can. At the end of the lecture, we will be happy to answer to all your questions, either immediately or later. And now, in the next lecture, Dr. Luca Zilberstein will focus on the general rules of anesthesia and interest and advantages of dissociatives. And then I will talk about Zoletil, all its benefits and its uses in India. I will be mainly on the regulatory and Virbac point of view, and Luca will talk as an anesthetics. So I thank you. And now, Luca, the floor is yours, so you can take over my presentation. Thanks.
Thank you so much. Thank you very much to Christelle. Thank you very much to Virbac and everybody. I will start with this presentation. Thank you very much with all. And I'm very, I'm very happy to share with you this part of my life, that is the anesthesia management about our patient. As Christelle says, we will start with this general part of anesthesia. Of course, I will try to simplify these specialties as much as possible, but as you already know, anesthesia is nothing simple, because anesthesia is a particular status of the patient where we use drugs, we inject drugs, and we transform the patient in something insensible. This kind of situation is chemically controlled, and this word control has to be one of your key points in your mentality when you work in anesthesia. There is not one anesthesia that is similar to another. Every anesthesia changes from patient to patient. Of course, we use rules. I will show you some key points to try to simplify this status as much as possible, but we have to keep in mind that anesthesia has to adapt to every patient, because patients are different from them. Even if you consider 10 rabbits that they are all similar, for example, experimental rabbits, they are not similar. They seem quite similar. It's for these reasons that a lot of time you have difference, and you have an animals that sleep fine and well, another animal that doesn't sleep, another animal that dies, just because they are different, and we use the same protocol. And if you use the same protocol and we don't adapt the protocol to what the animal asks to us, sometimes we make some mistake just because we don't see. So let's start from the beginning. Anesthesia means insensibility. It's something that we already know from the Greek time, even before, but this status has to be reversible. This is very important because we don't have just to focus on the animal that wake up. We have to focus on the fact that all the drugs wear off from the animals, and this artificial intoxication that we provoke has to be 100% reversible. This is very good anesthesia. And what is the difference? Like Paracelsus in the 15th century told us, so a lot of time ago, he said poison is in everything, and no thing is without poison. It means the difference is the dosage that we use with the drugs. You can use, for example, curare. Curare are very potent drugs. You can use for medical purposes, or you can use to kill animals. Pentobarbital. Pentobarbital is an excellent anesthetic, but a lot of time you use as euthanasia. The difference is in the doses. So we have to adapt our way to conduce anesthesia to what the animal asks to us. And we have to adapt the doses, and we have to adapt the cocktail. I will give you some tricks to try to avoid a lot of problem adapting your anesthesia and sharing the toxicity over many different drugs. So statistically, you will decrease the risk of one drugs. So let's go over. Anesthesia can be also something very complicated and very, very challenging. We cannot do everything that we want or we would just with one technique. So we have to adapt techniques. In this picture, for example, I don't know if you can see the animals, but believe me, there is a dogs on the table and a lot of cable, monitor, and a lot of things. And of course, we don't need, hopefully, this kind of anesthesia every day. But this was a tetanus dog that was kept in anesthesia for 7 days to try to desintoxicate him from the toxins of tetanus. So if you see, anesthesia can help you a lot of time, but you have to adapt the way to conduce anesthesia to what you need and what the animals need. Of course, to keep anesthetized an animal 7 days is not very complicated from the pharmacological point of view. The major point of the anesthesia that I didn't calculate, it was the human resources, because to keep an animal anesthetized for 7 days, usually you need 10 persons. So this was the key point of the anesthesia, not the table, not the cable, just the human resources. So when we use anesthesia, anesthesia implies many different repercussions as insensibility, unconsciousness, and muscular relaxation. This is anesthesia. And of course, we provoke an intoxication of the body, and we can keep this intoxication on 3 major points: respiratory system, cardiovascular system, and nervous system. Those are the major points, not the only points, the major points. Of course, we prefer consequence of the kidney, consequence on the liver, but the major 3 points that we have to control, and if we control these points, we control all the body, is the cardiovascular, respiratory, and nervous system. If we are able to control these points, it's fantastic, because we will control the patient. So, the key points is that we have to produce a pain-free anesthesia, it means analgesia, a complete loss of consciousness in our patient, and of course a muscular relaxation. This means that is impossible if you use only one drug, and it's for this that I will suggest you to try to use cocktail of drugs to observe 2 major points, to try to have a dispersion of toxicity and to accumulate the benefits of the different drugs. And in the middle, we will keep the anesthesia. This is the balanced anesthesia concept. One drug we need that we push to toxic doses. If you use even the more expensive drugs that we know, for example, propofol or I don't know, sevoflurane, that is a volatile agent, I spend a lot of money, so this is an excellent anesthesia. Wrong, because you push too much the dosage of these drugs and you reach the toxic doses of these drugs. So the secret is to utilize multiple drugs, because you will decrease the doses, so you will have a low individual dosage and low toxicity. As an example, this is the balanced anesthesia. You use lidocaine, anesthetics, alpha-2 agonists, non-steroidal anti-inflammatory drugs, and of course opioids, and you keep the level under toxic level. If you use only one drug, like an anesthetics, for example, you increase the doses, you increase the doses, you increase the doses, and at a certain moment you will be in the toxic doses. So be very careful. What means unconsciousness? Unconscious will be excellent anesthesia, because the animal will not recall what happens. We will have a surgical immobility and, of course, a stability of a sympathetic tonus. So it means that we have to provide analgesia. I'm sorry, I repeat some key points because they are really, really key points. You know, a lot of time you say during the procedure, the animal is waking up, it's waking up. But why is waking up? Because he feels pain. You cannot sleep if you feel pain. So the first reflex is not to increase your anesthetic, but is to increase your analgesic. Because if you don't feel pain, for example, with an epidural anesthesia, you don't need to be anesthetized. So if you push very far your analgesia level, you can keep the anesthesia as low as you want. Secondly, if you want a surgical immobility, you have to provide good clinical condition. And of course, the sympathetic tonus, what does it mean? You increase the patient security for the survival. What are our veterinary wishes? Of course, I will hope that my animal go home very fast. So I need for a fast and predictable anesthesia with less hemodynamic repercussion. It means high survival rate and zero pain. It means that the animal can be very safe in the postoperative moment. But this is not always available, because we have to adapt our monitoring. We need some technicians, some very right person that are close to know, and we need also a lot of anesthetics. But on this last point, believe me, in the last period, we really get a lot of new anesthetics and new anesthetic techniques that honestly will help us a lot. So we have all the drugs today that we need in anesthesia. We can do really great job. The essential of an anesthesia is to start point by point. What is the first point of every anesthesia is the patient evaluation. Of course, with my patient evaluation, I will know my patient, the patient that I have in front of me, and by this way, I can evaluate him and adapt my balanced anesthesia. And by this way, I can offer him some very important security points. I will come back on these security points, like oxygenation fluid, and survey. It means monitor him. We don't consider we don't have to consider a 10,000 euros monitor. Even clinical monitoring is quite enough if you survey your capillary refill time, your mucous membrane color, your pulse, your heart rate, your respiration, basically how it works. And with a lot of time, just hearing your animals, you can discover a lot of things, a lot of signs that he's telling you. We don't need a lot of time, a very expensive monitor to follow our anesthesia, especially if we use some very safe anesthesia like dissociation. I will come back on this very important point of dissociation because it's a very important part of our anesthesia world in specific condition. Why they dies? They dies because a lot of time they are sick, and we don't anesthetize a healthy patient, but we anesthetize sick patients. This is a classification that we use in anesthesia to class our patient by anesthesia risk, but anesthesia risk is correlated though to the physiological condition. And as you see, easy 1, 2, or 3 are almost healthy patient. It means this is a human, but we can transpose, of course, for animals. It means patient that don't have any real problems. For example, they suffer a fracture of ligament cruciate reparation. They need for a spaying procedure, castration, for example. So they are almost healthy, and we have a very low risk. But unfortunately, we have 2 more risk class that I mean is 4 and 5, and they are very, very unhealthy, very sick patient, like for example cardiac dysfunction or other problems, and we are in a very risk conditions. So by this way, we have to adapt our anesthesia. We cannot consider to anesthetize these 2 classes of patients like the other 3, because we will get a problem, and the problems is named dead. So we can produce anesthesia by different way. The most common way that we use is chemical anesthesia. We can use injectable drugs. They are less expensive, very practical, but they have, of course, some limitation. And we can use volatile agent. They are, of course, more flexible, because we can adapt to different kind of patient, different kind of animals, but they are more expensive and they need specific devices to be used, because with injectable drugs you use just a syringe catheter, and with volatile agents you need an anesthesia machine and specific techniques that you have to master. So by injectable drugs, we use different way of injection. Of course, you know them, intramuscular way, subcutaneous, IV, intraperitoneal. We can use almost every kind of way to inject these kind of drugs, and with other drugs, volatile agent that are anesthetic vapors, you can use only the respiratory system to administer. So from one point of view, they are very safe, but from the other point of view, they are complicated and cumbersome to use, because you need to keep the control of the respiratory way of your patient, and of course he loses some reflexes, and you have to keep in mind that you are driving your patient over the anesthesia, and your patient has lost a lot of reflex, and you have to keep all this condition in mind to drive him safely all around the anesthesia. The 4 major points of anesthesia are 4 steps that are really important to memorize, and you can keep together, but you have to memorize that there are 4 different steps. The first step is pre-medication, the second step is induction, third is maintenance, and of course the recovery of the patient. With some kind of anesthesia techniques, all these steps, these points are together. For example, with dissociative. But if you use other techniques of anesthesia, these steps are separate. When we go over anesthesia, it's not just anesthesia. We have different levels of anesthesia. The first is sedation. The second one is excitation. And only the third level is named real anesthesia, light, moderate, and deep anesthesia. And if we go over, we have coma. But we can produce this by different way, but we have to keep in mind that when the animal sleep, doesn't just sleep. He can be in a different level of anesthesia. And it's for these reasons that sometimes we observe just the animal wake up, but it doesn't really wake up. It's moving from one level to another level of anesthesia, but he's not really wake up. Of course, all these levels are, we don't have to consider this kind of situation when we use, for example, Zoletil or ketamine, dissociative drugs, because we spoke about dissociation. What is dissociation? Dissociation is another status, is the animal doesn't really sleep. He's dissociated. It means that he dissociated from the reality, from the environment. He cannot hear us better. He can hear, but he cannot correlate what he hear with what he feel. Is dissociated. So it's a very comfortable situation for us because he keep in mind, he keep a lot of reflex. He's almost autonomous. I will answer to the question at the end of the presentation, because I'm reading also the chat simultaneously, and a lot of answer to your question will be explained during my presentation. So this is dissociation. Dissociation doesn't mean that you don't feel pain. Dissociation means that you are dissociated from your environment. So if we dissociate an animals, we will keep some reflex. The animal will keep the open eyes. The animal keep his swallowing for reflex, for example, his respiration. And we have to improve this dissociation with, of course, painkillers or other drugs to have a full anesthetic situation that we can use during a surgery. But even with dissociation, we need to prepare our patient because prepare the patient means prevent any possible accident, improve our survival score, and simplify, of course, our anesthesia. I think that everybody has in mind some patient that doesn't sleep. And a lot of time, this patient that doesn't sleep during anesthesia were very stressed patient at the beginning. You know, your fractious cat or your very stressed dogs that comes in your clinics, and you just inject and it doesn't sleep because it was very stressed. Or your very young patient that is healthy, but because he's young, is stressed. So try to prepare your patient to the anesthesia, and I will explain how, and you will find a very simple anesthesia to manage. Of course, except emergency situation. So the key points are decrease the stress, use tranquilizers, reduce the secondary effect, for example, use atropine, reduce the anesthetic, use multimodal anesthesia, and a lot of analgesia. Optimize the recovery. It means use a monitor or survey your patient, because sometimes your animal doesn't wake up fine just because you forget during the anesthesia and he was hypotensive, or he bleed a lot, he's hypothermic, and so he doesn't wake up fine because we didn't monitor him finally. And of course, be fast. It means that if anesthesia is short, you will have less consequence of the anesthesia. Different strategy. If you use a full injectable anesthesia, we have only two strategies. or we use dissociation, so Zoletil and ketamine, for example. They are very practical because you inject once and you have 1 hour of anesthesia, more or less. Or we use total intravenous anesthesia with propofol, alprazolam, but it's something complicated to manage because it means that you have a syringe pump that pushes the anesthetics all the time of anesthesia, and you have to survey that. So it's something complicated to manage. And the other way is volatile energy, but you anesthesia, of course, anesthesia machine. The two key points that you have for all the anesthesia is the cardiovascular system and the respiratory system. So keep in mind that with all the anesthesia that you do, you have to survey these two key points of your patient. This does what means that they are the two life points for any situation. What I can suggest to you, even if you use a very simple anesthesia, like for example, dissociative drugs, put an intravenous catheter. He will take for you between 1 and 2 minutes, but you will get vein. It means that you have a life point, one of the two key points of our patient. It means the cardiovascular system access. The second point is the respiratory highway. You can drive an excellent injectable anesthesia just putting a trachea tube. It means a tube in the first highway of the patient. And by this way, if you have any problem, you can do something. Secondary, if you make or dentistry or I don't know, other kind of procedure, you will keep safe the first highway. You can put easily a trachea tube. It's not really expensive. You don't need an anesthesia machine, but you just protect the highway of your patient. And it will take, again, 30 seconds. So between an intravenous catheter and a trachea tube, you will lose more or less 2 minutes. It's not a lot. So if I could resume the difference between a volatile anesthesia and injectable anesthesia. For volatile anesthesia, the negative aspect are the constraint, of course, and the price, the skill that you need. It means how it works, how I can use the installation and the initial budget, because it's quite expensive to buy an anesthesia machine. But on the other ways, you will be more flexibility. Is safe when you know how to use. It's multifunction because you can use on different stages, on different age, on different patient. But again, it's something that you need to know how it works, of course. Injectable anesthesia with dissociative drugs is, of course, less flexibility because when you inject, you cannot take out the drugs that you inject. And if you inject too much, you risk accumulation. But the other side is very simple to drive. It's very safe because the animal keep a lot of reflex. You don't need initial budget because you don't need an anesthesia machine. And it's very comfortable for the veterinarians because with one protocol, more or less, he can produce a lot of different situations. But the major point of this anesthesia is the accumulation. And I will try to explain you as simple as I can. What is the accumulation problems? When you put a drop of color in a glass of water, you see the color, of course. But after, if you turn around the water, you don't see anymore the color. This name distribution. Another way, dilution. By this way, if you inject once your dissociative, he will give you the color, it means the anesthesia. And after a certain time, you will wake up because your body dilutes the drugs in the fat, in the different organs, or you eliminate the drugs and you wake up. But if you inject, as an example, when the animal doesn't sleep, and you inject a lot of time, but you see the color of a dark color, it means accumulation. And by this way, the recovery will last for a while, because you need to wait a lot of time that the animal eliminate, filter all the drug that you give. So one of the major suggestions that I can give you is try to produce a very fine protocol at the beginning with some tricks that I will give you now, and don't push too much the secondary injection. Of course, if you have to inject because the animal wake up, you have to inject. But maybe 1/3 of the initial dosage, and don't try to inject so much. So be fast and try to use other techniques. Don't worry, I will show you. So my suggestion is to use injectable anesthesia for standardized procedure. It means ovariectomy, castration, foreign body, I don't know, mass. You know that you will spend 30 minutes, 40 minutes, you know. So it's a very standardized procedure, very common procedure, you know it. And a volatile agent for the tricky procedure or something you don't know, an emergency patient that you don't know what happens, or in for example, in birds or in other kind of species that are more predictable. But it doesn't mean that we cannot use injectable. These are my suggestions. Of course, we can use injectable, but you know, if you have a Ferrari, you cannot ask to the Ferrari to go in the field. You need another kind of car, of course. So this is how we can optimize their use, because they can offer you different advantage. And as I told you, dissociative keep reflex, for example, and the effect of dissociative are slightly dependent from doses. And they are independent from the surgery. And a lot of time they are independent from the patient. With volatile agent or propofol, for example, we are very, very dependent from the stress and from the other situation of our patient. So those are examples where I suggest you to use, for example, dissociative anesthesia, but always in combination with other drugs, analgesics, tranquilizers, and of course, according to the length of the procedure. As an example, I can use Zoletil, for example, in association with alpha-2 agonists, opioids, phenothiazine, because I will have a better effect of my drugs, and I will keep in mind that I will offer to the patient a more safe anesthesia. Those are just examples of procedure, for example, that I can do for dissociative drugs, like application of casting, dental procedure, some kind of examination, minor surgical procedure, or to calm and facilitate the restraint of fractious animal. And I will show you some example. As an example, you can associate atropine to Zoletil, to xylazine, and have in one injection an anesthetic protocol to immobilize your patient. And of course, you have to add opioids, for example, butorphanol, buprenorphine, or the new opioids like tramadol, because by this way, you will have dissociation, you will have sedation, and you will have analgesia, in only one injection. And by this way, you have a full protocol in one injection. If you know the procedure, you know the length of your procedure, and you keep this protocol, you will offer to the animal an excellent quality of anesthesia. Don't forget that a lot of time we can block the nociception just with local anesthetics. Use them as much as possible. Don't forget that you will need some seconds to make a local anesthesia, and that lidocaine is very cheap. So if you anesthetize the mass that you have to keep out from your patient, you almost don't need anesthesia because he's completely blocked. So your anesthesia will be very light. You can block a lot of part of the body, even for castration. You just inject lidocaine in the testicles, in dogs, in cats, in bulls, in horses, in goat, in sheep, in whatever you want, and he will be anesthetized. So when you make your surgery, you will not feel pain. You can anesthetize also extremities. You just inject lidocaine over the nerves and you block, for example, the limb, and you take out foreign body or you make amputation. You can also inject in the vein. Of course, you block the circulation of the blood first, but after you can use the vein to inject lidocaine, and you block the sensibility of your legs. So those are the tricks that I suggest you to optimize the use. And of course, the cranial nerve, they are really, really easy to block. For the dentistry is excellent when you have to take out dental. And you could go over the epidural way or some other ways. In cats, for example, is very simple to do. Another way to use dissociative drugs is on wild animals. And I could say that dissociative drugs is the gold standard for wild animals. And in this part, Zoletil has made the history of the chemical restraint of wild animals, because of course, in wild animals, you cannot ask, please keep calm, please don't move, please give me your hand to keep a vein. You have to inject. And Zoletil has the advantage to be very concentrated and is a powder. So you can concentrate and dilute, for example, with xylazine and make a very, very concentrated drugs that in few milliliters anesthetize a rhino. Okay, a rhino is something of very, very big because it can weigh 2 tons, but you can anesthetize a lot of animals with, for example, dissociative like Zoletil and xylazine. This is a gold standard protocol, medetomidine Zoletil, xylazine Zoletil for wild animals. And when I'm speaking about wild animals, I'm not speaking of this nice picture of a friend of mine, but I'm speaking about also these wild animals that is named cat. And a lot of time, we have very fractious cats that keep in our clinics, and they are like miniature tiger, and we cannot approach them. So we need dissociative protocols to block them. I will finish my presentation with another picture about the use that we can make with dissociative drugs, is to associate them to one drug that you know very well, like propofol. And we do a mixture, I name it Zoletil, Zoletil plus propofol. And we use this mixture for the induction, only the induction of anesthesia, that of course we will prolong with iso, for example, isoflurane. But the difference of this induction is that compared to propofol induction, this induction is more stable, and he offers a cardiovascular support to our patient because we use the positive effect of Zoletil and the positive effect of propofol. By this way, we decrease the dose of propofol that we use, and we keep all the advantage of Zoletil for the cardiovascular system. And so I use a lot of time this kind of induction that I name Zoletil to induce critical patients that are not very stable. And great. So by this way, by this association, you have a very economic induction because you decrease the cost of propofol. You have a very stable cardiovascular system during the induction phases that is the more at risk part of anesthesia. And of course, we accumulate the advantage. We conduce a research in Alfor, in the University of Alfor, comparing Zoletil to ketofol. It was the association between ketamine and propofol, and we see that they were absolutely comparable, the two induction. So Zoletil can be another way to induce our anesthesia for people that are used to volatile agent anesthesia, I can suggest them to try this mixture to have a more stable induction for the anesthesia. In conclusion of this short presentation that was just made to give you a window over all the anesthesia and what anesthesia need, what you can do with anesthesia, but also what you have to do to conduce a good anesthesia. Anesthesia need to be attentively planned. It means know your patient, know what you can use, and make the association that you need for the patient or for the condition that you have. In this situation, dissociative have an advantage, sorry, there is a mistake in the presentation, an advantage in difficult situation because we are speaking about dissociation, and dissociation is advantageous over anesthesia for some critical point. And never forget to use multimodal techniques to optimize the use of the drugs that you have during the anesthesia. Thank you all, and of course, this is a long history that has to be continued. Thank you all for your time. I stop.
Yeah, thank you very much, Luca. I will now introduce Zoletil. Okay, so thank you very much, Luca. I will talk about the ingredients of Zoletil in the next speech. So how they work, how they are metabolized. Then we will have a few words about the indications of the product in India, and I will finish with examples of practical use. So let's start with the basics on the active ingredients. And as we said, Zoletil is a combination of a benzodiazepine and a dissociative anesthetics. So let's start with the benzodiazepine. As you know, GABA is the main inhibitory neurotransmitter in the central nervous system of mammals. So it means that it reduces the activity of the neurons or nerve cells. What does benzodiazepine? A benzodiazepine will enhance, will increase the effect of GABA. So it will induce sedation, muscle relaxation, and it decreases anxiety. On the other hand, glutamate is an excitatory neurotransmitter. It binds to the NMDA receptor, and it's very important for the wakefulness and the pain signaling. So what does stiletamine? It inhibits the action of NMDA receptors. So it means that it interrupts the transmission from the unconscious to the conscious brain, and it induces a dissociative state between the thalamus cortex and the limbic system. When you combine both molecules together, you have what we call a multi-component anesthesia with a synergistic action. So remember the table I showed during my introduction, where with all the molecules and the different clinical qualities, when you combine a benzodiazepine with a dissociative, you can target the analgesia, the loss of consciousness, and the myorelaxation. So more in detail. When we look at analgesia, Zoletil will provide a moderate, superficial, immediate, and visceral analgesia. What is interesting is that it reduces the reflex movement attributable to pain, and it also prevents the hyperalgesia following tissue trauma. Zoletil will also induce a loss of consciousness without bulbar depression. It preserves the laryngeal and palpebral reflexes. So it's important for you to be aware of that, because Zoletil might not be the best drug to use for ophthalmologic surgeries, as you still have the palpebral reflexes that are maintained. Then Zoletil induced a fast catalepsy followed by relaxation of muscle, and this muscle relaxation is similar to the one provided by inhalation anesthesia. So let's look now at the metabolism of the drug. if you look at the first line, it's interesting to notice that after intramuscular injection, the both molecules reach rapidly the maximum concentration in the blood of dog and cat. So it's in 30 minutes. Then looking at the half-life, so the elimination of the product, we can see that in dogs, zolazepam is eliminated more quickly than tiletamine. So it means that there will be in dogs a shorter duration of tranquilization than there is of anesthesia. On the contrary, in cats, you can see that you will have a longer duration of anesthesia compared to dogs. But interestingly, you will have a smoother recovery because of the PK difference. In cats, the zolazepam is eliminated less quickly than tiletamine, so the recovery will be smoother. And I believe it's interesting, especially if you know those cats that wake up after a ketamine anesthesia and that are sometimes in a kind of crazy state. So if we look at numbers, what does it mean? With Zoletil, it means that you will have a fast onset of anesthesia. With an intravenous injection, it will be under the needle in less than a minute. With the EM route, the anesthesia occurs in 3 to 6 minutes. Then the anesthesia will last for 20 to 60 minutes. And of course, it depends on the dose you use, but also on the animals, if he has some disease or not, on the type of surgery, and on the concomitant medication that you will use. And to finish, with Zoletil, you have a rapid recovery. In practice, it's in less than 2 hours. So let's look now on the comparative pharmacology of ketamine plus diazepam versus tiletamine plus zolazepam. So concerning the dissociative agent, with ketamine, you have a short duration of action. And with tiletamine, we know that tiletamine is 2 to 3 times more potent than ketamine. And now I would like to give you a few words about the addictive use of dissociative agents. In an internal study in Virbac, we have compared the addictive potential of ketamine versus Zoletil. So drug-naive rats were used in those studies, and they were conditioned either with saline, with ketamine, or with Zoletil at different dosage in gray. Zoletil is in gray, ketamine in black, and saline in white. What we measure is the time that the rats want to spend with the drug, so with ketamine, with Zoletil, or saline. And we clearly see that when they are conditioned with ketamine, they want to spend much more time on ketamine. So of course, for a single dose, for a single dog that you anesthetize once, there is no point. We don't care. There won't be any addictive use. But it might be interesting, especially for the recreative use from human being. If those human people are looking for a dissociative agent for their own usage. With Zoletil, you have less risk. Looking at benzodiazepine, we know that zolazepam is less likely to cause central nervous system depression than other benzodiazepines. And then for the association, Zoletil will provide a good myorelaxation, less CNS depression, good duration of action, and a good analgesia. Let's look now on the indication of the product. So in India, the product is indicated as a restraint and as a general anesthesia for dogs, cats, and wild animals. So practical example, so for sedation, you could use Zoletil for examination, for handling of difficult animals, so cats, for example, for diagnostic procedures such as biopsies, otoscopy, or for catheterization. It can also be used for minor surgery, such as neutering or dental procedures, and for major surgeries, such as orthopedics or mastectomy. Of course, for those surgeries, you need to provide adequate analgesia. As for many anesthetics, Zoletil is contraindicated in animals with severe conditions. So, for example, cardiac or respiratory disease, renal hepatic insufficiency, severe hypertension, and head trauma. It should not be used neither on pregnant bitches, and I will come back on it later in the safety part. For the dosage, so few things to consider. First thing is that the animals should be fasted for 12 hours prior to the anesthesia. Then, for the route of administration, with Zoletil, it's interesting because you can use several routes. So, on a regulatory point of view, the product is authorized for IM and IV route, and depending on the type of procedure, you just need to adapt your dosage. We have internal data with the oral route and the subcutaneous route, subcutaneous in dogs especially. And for the oral route, what we can say that the product has a kind of bitter taste. So we know that in cat, you need to cover this bitter taste with a feed. When you use the IV route, you can repeat the injection. So to prolong the anesthesia. You can repeat up to a third or half of the initial dose, and you should not increase more than 26 milligrams per kilogram. If you redose, it will prolong your recovery time. What we recommend for the recovery phase is to be in a calm environment with no noise and no light. In obese, old, or debilitated animals, this recovery time may be. So some practical tips. In geriatric and debilitated animals, as for all anesthetics, the dosage needs to be reduced. And we do not recommend to use Zoletil alone for pain operation. We recommend to combine it with analgesics. So let's talk now about the safety. So we say that Zoletil has a wide safety margin. So what does it mean? It means that we calculate a therapeutic index. And this index is calculated as a ratio between the therapeutic dose and the toxic dose. In dogs, the therapeutic dose is 10 milligrams per kilogram, and the lethal dose is 100 milligrams per kilogram. So we have a ratio of 10. And in cats, this ratio goes up to 22. So as I told you, for pregnant dog bitches or queens, we know that the product crosses the placenta. So it may cause a respiratory depression in newborns. But we know also that some studies have been conducted in laboratory animals, and we do not have any teratogenic effect of the product. But as the safety of the product has not been evaluated during pregnancy of dogs and cats, this use should be done only according to the benefit-risk assessment that you will conduct. For very young animals, less than 1 month old, we do not recommend to use Zoletil. Talking again about safety. So for the adverse reaction, when you use it intramuscularly in cats, you may observe some pain at the injection site. Then you have the classical signs due to anesthesia. So neurological signs, cardiorespiratory signs, and systemic signs. Hopefully, those signs are reversible. So they disappear when the actives are eliminated. If you overdose the product, the first sign that you will observe will be loss of cranial and spinal reflexes. And it can lead to cardiorespiratory depression and CNS depression. Another thing that you can observe with Zoletil is hypersalivation, and this can be controlled with the administration of atropine. So practical information. I will talk a lot about flexible anesthetics with Zoletil. Flexible because it can be used in combination, so you can have a balanced anesthesia. So Zoletil can be used for fixed anesthesia, so combined with alpha-2 and analgesics, or it can be used with volatile anesthesia. So some example of combination in dogs. So you induce your anesthesia with Zoletil, and you can use premedication. You can decide to not have any premedication, or for painful surgery, you can add alpha-2 agonist. You combine with analgesics, and then you maintain with isoflurane. Same type of protocols in cats. Flexible also because it can be used in a wide number of species. Zoletil is a kind of universal anesthetics. It has been used in ruminants, in equine, in birds, in reptiles, ursidae, primates, and also in wild animals, canines, wild canines, wild canines and wild felids. On the practical point of view for the storage, the product has a shelf life of 2 years, and before reconstitution and after reconstitution is 24 hours in the fridge. It written on the notice that the product should not be mixed with any other medicinal products. But we have internal data, so off-label, that states that the product is stable and can induce efficient anesthesia when the product is kept for 8 days in the fridge. And we have also data showing that if you combine Zoletil plus medetomidine and butterphenol in the same vial, the mix is stable for 24 hours, again, in the fridge. So for the storage condition, it's important to protect the product from light and to keep it in the fridge. So as a conclusion, I come back on my double star that I presented during the introduction with the clinical quality and the practical quality. With Zoletil, you induce a good loss of consciousness. You induce myorelaxation with Zolazepam having a better quality than diazepam. You induce analgesia, again, tiletamine being superior to ketamine. And you have a safe product. We have a wide safety margin, and this product has 30 years of experience at international level. On the economical point of view, you do not need to invest on any specific equipment. You just need a syringe and a needle to use Zoletil. The product acts rapidly with a rapid onset of action and rapid recovery time. It's easy to use for the practitioner because you can use it IV or IM. You can use it in multi-species. You can use it alone or in combination. And it brings comfort for you because you have a fixed combination of a dissociative and a benzodiazepine. And depending on the dose you choose, you can use it for sedation or surgeries. So as a conclusion, this is the first time that we have such a combination in India, and this is exclusively for the veterinary medicine. Zoletil is a 2-in-1 injectable that offers convenience, easy dosing, and compliance. And with the ready-to-use balanced combination of these two synergistic molecules, it will leave little room for error. I thank you for your attention, and I guess we are ready to answer to the questions on the chat. Thank you.
There are nice questions on the chat. I'm reading them. I think that for the commercial question, price or other things, I think that you will be more used to answer, or maybe I think that it will be a very strong communication about Zoletil that will follow this presentation. You have to consider that this presentation was only an introductory presentation to these products and to the anesthesia. But of course, we cannot resume 25 years of Zoletil anesthesia in 35 minutes. So by this way, I'm sure that you receive support from Birbach about many different protocol support. As an example, I see twice a question about the zebra, and I would like to answer to this question because I anesthetized zebra with Zoletil, and or fractured zebra. It works fine. It works fine, better than in horses. I don't know why, but when anesthetized zebra, they were immobilized, and I can approach them. The difference is in the dosage, and you can have a zebra that go down or a zebra that just is immobilized and you can approach, because zebra can be very, very aggressive. So yes, you can. So.
There's a question, Dr. Luca, about can Zolifol be used for maintenance of anesthesia?
Yeah, No. What I suggest is another way to think about Zoletil, that is not to change the way to conduce anesthesia. It means that if you give Zolifol, the mixture between propofol and Zoletil for the maintenance, and your maintenance lasts for 1 hour, 1 hour and a half, you will accumulate So it's not the strategy that I suggest you. The strategy to use your Zoletil was just for the induction and continue your anesthesia with volatile agent. If you have to make an injectable anesthesia, I suggest you to start with an injectable protocol like Zoletil, xylazine, your classic dissociative protocol.
Right. There's another question from Dr. Sridhar. It is mentioned that Zoletil provides a good muscle relaxation equivalent to inhalant anesthetics. For example, isoflurane provides low muscle relaxation. So will Zoletil also provide a poor muscle relaxation? Or is there any other better comparison?
The Zolazepam that is associated with tiletamine is made to try to smooth the dissociative effect of the tiletamine. And by this dissociative effect, you have also the muscular contraction. So, of course, we always associate dissociative drugs with a muscular relaxant drug like benzodiazepine. But if you increase this aspect of your protocol, giving xylazine opioids, you will decrease at the same moment the doses of the dissociative drugs. And it's this kind of equilibrium that I strongly support and I strongly push you to try to find. So it's not used just, boom, one injection of Zoletil, but is to associate these drugs with the other drugs that I suggest you to have this better equilibrium, and so less muscular tone and better comfort for your animals.
All right. Another question from Dr. Sridhar was, is 12 hours of fasting recommended for all species? Would there be any variation with age of the animal?
I didn't find this question, but the question is about fasting, no?
Yeah. 12 hours. It was sorry, Lucas. So I just answer on a pure regulatory point of view, and you will give your opinion on the anesthetics point of view. So 12 hours fasting. So 12 hours fasting is what is written on the label of Zoletil for India, but of course you can adapt this period depending on the animal you have to manage.
Yeah, thank you, Christelle. What I would say to everybody, Christelle, of course, he observed all the rules, all what is written, and I observe too, of course. But my point of view is the point of view of a vet that use drugs. So it means that a lot of time, we use drugs off-label. We know how to use them, but this means that it's off-label. But a lot of time, even if we use the drugs as is in the label, there are some differences, because in the real life, but the real life is different from the theoretical life. So this was just to answer you that the fasting procedure of your animals is something that is related to the stomach emptying. So of course, if we have a puppy, for example, we know that half an hour after, his stomach is empty. And if we have a brachycephalic dogs, we know that 1 day after, he still has something in the stomach. So it's for this that in the label is written 12 hours. But of course, it doesn't mean that if you have an emergency patient that was hit by car, you have to wait 12 hours. Of course, this is an emergency procedure, and you have to do what you have to do. It means that, for example, if you have a young patient of 4 months, you don't need 12 hours to wait that his stomach is full empty. But it depends from the patient that you have. And if you anesthetize ruminants, for example, even 2 days of fasting is not enough. We are vet, so we have to adapt to the animals. But on the other side, don't take out water. Water is very important for patient, for us, for everybody. Water is also the hydration of the patient. So you don't take out water more than 3-4 hours, please. Otherwise, you will have hypovolemic patient or dehydrated patient. So keep water, please, till 2-4 hours before your anesthesia. Thank you.
All right. Another question: is there any apnea after the intramuscular injection, and how to best minimize that? Maybe Dr. Navarro can answer because it's part of our regulatory as well.
Yeah, I will feel more comfortable to get the let's say the experience of Luca to know when you use, the question is when you use Zoletil, do you observe apnea? So it's not officially written as a safety or adverse event of Zoletil, but this is something you observe with many anesthetics.
Yeah.
So just I let Luca confirm with his experience.
You know why we have apnea? Apnea is because we intoxicate the patient with drugs, and you can give whatever anesthetic you have on your hand, you can produce apnea. Even Paracelsus with ether provoke apnea. Okay, Paracelsus provoke also euthanasia, but this is because the doses. So you can have apnea with Zoletil, with propofol, with alpraxan, with isoflurane, with whatever you use, is the dosage. If you give Zoletil by IM, it means that the absorption of Zoletil is slower than IV. And it means that the plasma, please be careful to your microphone. It means that the plasma level, the concentration of the drugs that reach the blood will be slower compared to IV. So it's very uncommon to have apnea giving drugs by intramuscular way. On the same, if you give the same dosage of drugs by IV fast, you will have apnea. Because you reach toxic doses in the blood, it doesn't mean that he dies. It means that you depress the bulbar center of the respiration, and the animals make an apnea. So, by intramuscular way is very uncommon to have apnea. By IV, you have to give slowly. Otherwise, whatever you use as drugs for the induction, you will have apnea.
Thank you, Dr. Luca, for that. There's a question on the antidote for Zoletil. I think there are quite a few questions concerning that. Maybe we can repeat that part again, Dr. Christelle.
It doesn't exist, huh? There is no antidote to dissociative drugs.
No, you can use doxapram to reverse any cardiorespiratory issues, and we have flumazenil that can be used, but it's not real antidote. It's not like when you are used to have alpha-2 agonist, so medetomidine, for example. We don't have such a direct antidote for Zoletil.
Dr. Luca, what is your experience with Zoletil in brachycephalic kids? You briefly already answered that question, but if you wish to add, or we can move on to the next question.
I can shortly answer. Brachycephalic anesthesia is something that is more complicated than just Zoletil. Brachycephalic anesthesia is a different approach because brachycephalic dogs have a lot of problem of respiration. So the focus on the brachycephalic doses, the brachycephalic anesthesia is not the doses or not of Zoletil, is the anesthesia approach. So if you have this kind of question, it would be a pleasure for me to answer you maybe by other conference or by other way, but I cannot resume brachycephalic anesthesia with just the doses of Zoletil that we have to use.
Yeah, just to complete, Zoletil is not contraindicated in brachycephalic. What is really important is to make sure that you can maintain your airway. So even if you use Zoletil, you absolutely need to make sure to maintain a good breathing of the dog. But there is no contraindication.
Right. Moving on to the next question. Dr. Luca, would you recommend Zoletil for orthopedic surgeries, or your experience of Zoletil in orthopedic surgeries?
It depends from the orthopedic surgery. It means that for me, it's not the kind of surgery, is the kind of anesthesia that you need. It means it's not because you have a fracture or ligament cruciate that you will change from Zoletil to Propofol. Is what you will do. It means if you have an orthopedic surgery, like for example tibia fracture in a cat, in a dog, or in other animals, is a kind of procedure that you know perfectly. In a dog, for example, very simple tibia fracture, if you repair by external fixator or pins or something like this, is 25-30 minutes. Ligament cruciate, if you make an over-the-top techniques, is 40 minutes in a dogs. It means which is the procedure, not the orthopedic or not orthopedic, and sometimes you have a laparotomy that lasts for more than 1 hour. So Zoletil for me is not contraindicated. Of course we can use, but it depends from the procedure. If you have an orthopedic surgery that from the beginning to the end lasts 40-45 minutes, something like this, you can use, of course, Zoletil protocol. It means with other drugs, not only Zoletil. It depends really from the procedure that you have, not if it's orthopedic or laparotomic, for example.
Yes, I think it's really important. That means for orthopedic surgery, Zoletil can be used for induction, but not alone. That means you need to combine with analgesics, with volatile anesthesia if the surgery is supposed to last long time. So you can use it, but it's just part of your protocol.
Exactly. It's very. I would really stress out this point because I put in my presentation many times. The concept of the anesthesia is not one drug or one doses. If you do like this, you will wrong. The concept of anesthesia is to adapt the anesthesia to the procedure. And the procedure is not dermatology, orthopedics. The procedure is the procedure. It means what I would expect from my procedure, and I will adapt my protocol. Orthopedics is very painful sometimes, but you can stop this pain with local anesthetics. In laparotomic procedures, sometimes we underscore the pain that the animal feel, because if you have peritonitis, it's very painful. So once you plan your procedure, you adapt your protocol, and you will put the drugs that you need. Of course, Zoletil offers you a large flexibility because it's a dissociative drugs. But again, you have to adapt your protocol to the procedure that you have to do.
Right. Thank you, Dr. Luca. We've got quite a few of our zoo vets over here, and so they've asked about usage in birds like macaws and raptors.
Yeah, if I may, Vanessa, we have a full booklet of dosage for all those species. So maybe you will be able to share because we cannot answer for each species. We have a booklet with more than 100 of different dosage depending on the species. So I guess you can share it with all the vets if they are interested in those usage.
Yes.
I'm very jealous because I love this bird. I love macaws, raptors, and I see also from the last presentation that in India we get a lot of questions about these fantastic animals, and I'm starting to become jealous of India.
So you need to go to India, Luca.
Sure.
I'm just looking at the table we have with all the dosage. I cannot see the macaw in the list of birds for which we have a dosage. So maybe at the moment I do not have any answer.
I have a nice. I read a nice question. Sorry, Christelle. I read. Can Zoletil be used as CRE? Because I read some different questions about CRE. CRE is constant rate infusion. It means, for the people that doesn't know, to give the products continuously. No, you can it depends from the use that you want from the Zoletil, because if you want to support your anesthesia by a constant rate infusion of one drugs, Zoletil lasts too much time in the circulation to be easily used by this way. is not the same way as we use ketamine for analgesia, for example, on the NMDA receptors. For this kind of action, we use very, 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 very low doses of ketamine continuously for some days. We are not speaking about the same, so I don't suggest to you to explore this kind of way to use Zoletil as a complement of volatile anesthesia, because accumulation.
Okay, I think we take one last question because we're almost close to 4:30 in India. We have a cheaper option of ketamine and midazolam here. Again, I think just to reiterate the advantage of Zoletil over this combination. Dr. Navarro, maybe you can take this question.
Yes, I can answer rapidly. One advantage is for sure that it's a fixed combination. So you already have the mix ready to use with a dissociative agent and a benzodiazepine. The other advantage I was just explaining is that when you compare the potency of tiletamine versus ketamine, it looks like tiletamine is more potent than ketamine on the same ratio of concentration. Then for the difference between midazolam and zolazepam, there is not a big advantage, except maybe on the CNS depression, for which zolazepam might be slightly advantageous. So I will tell that the main advantage is really you have a fixed combination. It's approved for veterinary medicine, so it means that you have a full package of efficacy and safety data, and this product is for veterinary only. So you have it directly on your in the vet clinics. So I don't know, Luca, if from a clinical point of view you see any advantages.
Is almost everything is you already say, and is the difference is really the procedure that you want to do with this kind of drugs. They are similar association, but Zoletil offer the advantage that is made, is all in one, is made. And of course, if you use safely with the other drugs, honestly, I think that is a product that is really easy to use. Honestly,
yeah, really, that's the advantages. And as I said in my introduction, the objectives of Virbac when we develop drug is really to give you drug easy to use for the general practitioners. So I know that some of you are specialists and you will be able to combine and to do a lot of technical things. But what we want also to provide is product that the GPs can use in an easy way, safe way, and be efficient for the dogs and cats. So that's really a big advantage of Zoletil, I believe.
Yeah, absolutely.
Thank you, Dr. Luca, and thank you, Dr. Christelle. I think we've got a whole lot of questions, but we're running out of time. So what we will do is get back to you over the next, in this course of the week, for those that we cannot been able to answer right now. We will revert to you via email. So thank you for sharing your questions and for your immense participation. I have just a couple of slides to share with you on the availability of the drugs. So if I may do so.
Mm-hmm.
I hope you can see the presentation.
Not yet.
Not yet.
Yes.
It's coming. It's coming.
Great. Okay, so we did have a lot of questions from our doctors here about access to information about Zoletil, and we understand that given in the current scenario that our sales representatives are not able to meet you in person, what we'll be shortly doing is sending you a link which will give you access to a web page that will have information about Zoletil, all the advantages and features that we've discussed about today, the application, so the suggestive dosage charts for use in dogs and cats and even in wildlife, the suggestive protocols that we've got, the multimodal combinations with Zoletil. All of this will be accessible on this one web page, and the link of which we will send you shortly in the next couple of days. All right, so that should be easily available for you. And in terms of availability, at the moment, the product is available in Chandigarh, Ludhiana, Delhi, Kolkata, Hyderabad, Chennai, Bangalore, and to the west in Mumbai, Pune, and Goa. We're doing a phase launch in the current scenario. So this is currently where it is available, but over the next month or so, we're planning to launch all across India. The product or the variant of Zoletil that is available in India is Zoletil 50. That's because of the concentration, 25 mg of tilitamine, 25 mg of zolazepam per ml. It's a 5 ml pack totally after reconstitution, and it's priced at 1,500. That's the MRP. Okay. So I think with that, we come to the close of today's session. Just want to take this opportunity to thank all our canine practitioners from across the country for being available and participating. We really appreciate the time. We like to thank our veterinary professors from various veterinary colleges and students, our wildlife specialists who are here with us today. Thank you so very much. Our various associations, pet practitioner associations as well, who are with us here today. I can still see the questions pouring in, so we're going to make sure we respond to all of them over the next few days for sure. My thanks to Dr. Luca for being ever so willingly available for us, and the enthusiasm with which he has prepared the entire presentation. Thank you. Really, thank you. Thank you, Dr. Christelle. Your constant support has made today possible, the past session and this one. And of course, to our entire Virbac team here, despite the circumstances, it's been a fabulous outcome. And thank you so much for your presence. Wishing you a lovely evening ahead. And to Dr. Christelle and Luca, a lovely day ahead.
Thank you.
Thank you very much.
Thank you, everybody.
Thank you very much.
Bye. Thank you, Nathan. Bye.
Well,
Bye.
thank you.
Thank you.
Thank you.